Yes, yes, भैया.
So in sorry. Bhaiya, hope you all can see this slide.
Yes, we are now visible and your voice is also there.
जी भैया. Role of healthy lifestyle in thyroid dysfunction. So today we will discuss about this topic. Actually, the last week, 25th May, is known as World Thyroid Day. So this day is celebrated to create awareness about the thyroid dysfunction and how we can prevent it, how we can be safe from thyroid problems. So the same topic we will discuss in today's session. So thyroid gland is one of the largest endocrine gland in the body, and it is highly vascular organ. So the supply, blood supply, vascular means the blood supply. The blood supply to this gland is even more than the kidney. And in a 1 minute, almost 80 to 120 ml of blood is supplied to this gland. So you can understand how rich blood supply is going to this gland. Every cell in the body depends upon the thyroid hormone for regulation of their metabolism. So each and every cell in our body, they require the hormones which is secreted by this gland, that is T3 and T4. So T3 is triiodothyronine and T4 is tetraiodothyronine. So these hormones are required for the metabolism, for the energy production, for the synthesis of the protein. So each cell in our body, they require this hormone. And these hormones are essential for life and have many effects on the body metabolism, growth, and development. So we will know about the basics, about the basic structure and functions of this thyroid gland. So this is ductless endocrine gland, and its color is brownish. And the word thyroid is derived from the word thyros, the Greek word thyros, which means the shield. In the war field, we have the shield to protect our body. Similar is the shape of this, and so only the name given as thyros. And the gland is thyroid. The shape of the gland is like H shape, or we say it as the butterfly shape, and it extended from the fifth cervical vertebra to the first thoracic vertebra. So that is the extension where it is actually situated. It's located just below the larynx in front of our neck, and its weight is about 20 gram. So actually the functional unit of this gland is follicular cell. The gland is having follicular cell which secretes, which produce the hormones, and where the hormones are stored, that is the warehouse of this hormone. So the follicular cells are the factory and the storage house of the T3 and T4 hormones, and there is one more hormone which is secreted by this gland. The name is calcitonin. As the name itself suggests, calcitonin, so it is helpful in maintaining the calcium level in our blood. So whenever the calcium is high in our blood, so this calcitonin hormone, it helps to send this excess of calcium to the bones. So that is how the calcium level is maintained. And this calcitonin is secreted by the parafollicular cell. So these two cells are there which are producing the hormones, that is T3, T4 and calcitonin. T3 and T4 is secreted by follicular cell and calcitonin is secreted by parafollicular cells. Actually, we know that we all are very well aware that iodine is required for the normal functioning of our thyroid gland. So one important function of this thyroid gland is trapping the iodine which is present in our blood. And this iodine which we get from our salt or we get from various kinds of food which we consume. So this gland, it take the iodine ions from the blood, and the concentration of iodine ion in this gland is all 30 to 50 times higher than the circulating blood. And how much amount of iodine we require in a day? So a healthy adult, the requirement of iodine is 150 microgram. So 150 microgram is very less amount. So actually the 1000 microgram is 1 milligram and 1000 milligram is 1 gram. So we require a very less amount, a very minimum amount of iodine in a day. And in a whole lifespan, the amount we require iodine is just about 5 gram. So insufficiency of iodine, so there will be, because this T3 and T4, so at the name itself suggests there are 3 iodine ions, and T4 there are 4 iodine ions. So for production of these hormones, the sufficient quantity of iodine is very essential. And as I already told, that every cells in our body, they require sufficient T3 and T4 for energy production and for synthesis of the protein. So the sufficient quantity of iodine is very essential for normal functioning of our thyroid gland. So because of many of the government programs and lot of awareness which is created about consuming iodine, and iodine is mixed in the salt and many other food products. So are there some consequences because of the excess iodine intake? That also a question comes. So actually many of the people, a large amount of population can very well tolerate the excess amount of iodine, but few number of population, they cannot tolerate, and because of that, the excess of iodine, it creates thyroid dysfunction, and it may be hypothyroidism, it may be hyperthyroidism, or there may be some autoimmunity related problems. So autoimmunity, that means our body defense systems, it attacks its own cells. So there are researches, and these researchers, they say that excess iodine is responsible for the thyroid dysfunction. So long-term exposure to excessive iodine from water is associated with thyroid dysfunction. So that research already proved. Then effect of excess iodine intake on thyroid disease. So here also the research proves that the excess iodine in the local drinking water are essential to prevent thyroid disease. So that means we have to take sufficient quantity of iodine. Excess intake may cause thyroid dysfunction. So we will see what are the function of thyroid gland. So it controls energy expenditure of the body, and it is responsible for the heart contraction. So the pumping of the heart, that is also regulated by the thyroid gland, the thyroid hormones, and it stimulates the carbohydrate and protein metabolism, increases the synthesis and degradation of the cholesterol and triglycerides. So the amount of cholesterol and triglycerides which are there in our blood, that is also regulated by the thyroid hormones. So whenever there is a excess of triglycerides or imbalance in our lipid profile, we have to also consider thyroid dysfunction in that case, and we have to check our thyroid functions. So what is thyroid dysfunction? So thyroid hormones are required by each and every cells, and in the thyroid dysfunction, the large amount of population is suffering with the hypothyroidism, and a small amount of population is suffering with the hyperthyroidism. And women are largely affected, almost 5% women and 0.5% men. They are suffering with thyroid dysfunctions. And this thyroid dysfunction, it affects each and every system, each and every cell of our body, like the liver, intestine, reproductive organs. So many of the women, they get some menstrual irregularities because of the imbalance or the dysfunction of the thyroid gland. There will be depression or the psychological disturbances may also be there because of the thyroid dysfunctions. Our renal function will be affected, our heart function will be affected. So almost all the vital organs are affected because of this thyroid dysfunctions. So thyroid being dysfunction when the thyroid gland is underactive, that is hypothyroidism, and when thyroid gland is overactive, that is hyperthyroidism. And you can see this picture. So what happens in the hyperthyroidism and what happens in the hypothyroidism? So the hyperthyroidism person will be lean, but he will be having voracious appetite, excessive appetite. The hypothyroidism person will be bulky, he will be having puffy face, and his appetite will be low. We will see what are the other symptoms we will get in case of hypothyroidism. So hypothyroidism, it means the underactive thyroid gland. And actually this thyroid gland, the working of this thyroid gland is regulated by the pituitary gland. So pituitary gland is situated in our brain, and it secretes one hormone. The name is TSH. So whenever you have this thyroid profile, you will get the level of TSH. So that is thyroid stimulating hormone. So whenever the thyroid stimulating hormone is secreted, so it activates the thyroid gland to produce T3, T4. So the excess amount of TSH, that is indicative of that your thyroid gland is not working sufficiently. And whenever there is less secretion of TSH, it means that the thyroid gland is overactive. So in the early stage of hypothyroidism, the T4 level will remain normal, but the TSH level will be raised. So what happens is, because I told that the pituitary gland, it regulates the functioning of our thyroid gland. So to maintain the proper functioning of thyroid gland, the TSH will be secreted. And in initial phase, we say that the subclinical hypothyroidism, in that case, initially the TSH will be raised and the T3 and T4 level will be in the normal state. So there will not be much symptoms, but there that is indicative of that the thyroid is underactive. So hypothyroidism affects 5% of the general population, and almost equal amount of people who have thyroidism are who are having hypothyroidism, they are not diagnosed. So you can understand almost 10% population is affected with this hypothyroidism. And over 99% of affected patients suffers from primary hypothyroidism. So there is secondary hypothyroidism, which means the thyroid gland dysfunction is because of some diseases. There are certain diseases which affects the functioning of the thyroid gland. So like the diabetes also, it affects the functioning of the thyroid gland. So that kind of thyroidism, or there may be some problem in the pituitary gland which secretes the TSH. So some problem is there. The problem is not in the thyroid gland, but problem is somewhere else. So that kind of thyroidism, we say that secondary. But most of the people, they have the primary hypothyroidism. So what are the causes of this hypothyroidism? So there is an autoimmune thyroid disease. That means the body defense system, it attacks the thyroid glands tissues. So it damages the thyroid glands, the follicular cell, parafollicular cells which are present in the thyroid gland that are damaged. And because these cells are damaged, they will not be able to produce sufficient amount of thyroid hormones which are required for the normal functioning of each and every cells. And the iodine deficiency, which is the cases are less now because there are sufficient awareness among the people to have enough intake of iodine. Then iodine induced. So because of the excess intake of iodine, sometimes the person will suffer with hypothyroidism. Nitrogen exposure. There are certain food which affects the functioning of thyroid gland. We will see the list of these nitrogenic food. And again, the pesticides, fertilizers, which are used in very high amount, we consume such kind of vegetables, grains, etc. So because of these toxins also attack our thyroid gland, and because of that, thyroid gland function is hampered. And defect in hormone synthesis, there may be some surgery which happens, and because of that, like in the neck or in the thyroid, if there is some surgery, so because of that also there will be dysfunction. And the thyroid agenesis or dysgenesis, during the development, some problem happened in this thyroid gland, so it will not develop properly, or it will uh, be developed in a some irregular way. So because of that also the function is disturbed. And then again, hypothalamic pituitary disease. So the because of some problems in the pituitary gland or the hypothalamus. So hypothalamus secretes one hormone, that is TRH. So thyrotrophin releasing hormone. So if some problem in that area, so because of that also there will be some dysfunction of thyroid gland. Thyroid dysfunction or the hypothyroidism is also tagged as the lifestyle disorder. So are there some lifestyle factors which are responsible for the thyroid dysfunctions or the hypothyroidism? So there are several researches which says that lifestyle is associated with thyroid function in some clinical hypothyroidism, a cross-sectional study. So this research article concluded that staying up late on weekends, uh, lack of exercise, iodine excess, smoking, these are uh, lifestyles which are affecting our thyroid function. Again, there are researches association between lifestyle and thyroid dysfunction. So here the article concluded that we found association between different lifestyle factors and the incidence of different thyroid disease. So this is very clear that our lifestyle, our diet that affects the thyroid functions. So not necessary that because of the excess intake or because of them some nitrogen food, there may be involvement of our lifestyle like the smoking, waking up late in night, waking up late up to the night, lack of physical activity. So these all lifestyle factors, they affect the function of thyroid gland. So what are the common symptoms the person will get in the case of hypothyroidism? So there will be tiredness. The person will feel very tired. Even without doing any work, he will feel very lethargy, loss of interest, forgetfulness, dry, coarse hair. So the hairs will be dry, falling off hairs will also be there. Then there will be puffiness of the face and eyes. So there will be some mild swelling around the eyes and in the cheek area. The person will be having puffy face. Then the heartbeat will be slow because the thyroid hormones are responsible for the heart contraction. So when there is a hypothyroidism, the heartbeat will be slow. The dryness of the skin, the person will not be able to tolerate the cold. When the patient will come, he will complain or that he is not able to tolerate the cold. He is feeling excessive cold. There will be weight gain in the women, females. There will be menstrual irregularities. The constipation, and the person will suffer with constipation, the brittle nails. So these all various symptoms the person will get, and even he will feel very depressive. So this is how we can uh, remember the symptoms of hypothyroidism, that is sluggish, sleepiness, loss of memory, and unusually dry, coarse skin. There will be goiter, that is enlargement of thyroid gland, and gradual personality change or depression, increase in weight, puffiness of the face, and sensitivity to the cold, hair loss, or the dryness of the hair. So these all symptoms we will see if a person is having hypothyroidism. So how this is diagnosed? So when these all symptoms are there, normally when the person will visit to the doctor, he will take detailed history. He will do some physical examination, like he will examine the skin texture and he will see the hairs, how they are, and he will check the thyroid gland whether it is enlarged or not, and he will suggest, the doctor may suggest some laboratory investigations. So generally the doctor will suggest for the thyroid profile, that is T3, T4 and TSH. So T3 is triiodothyronine, T4 is tetraiodothyronine, and TSH, that is thyroid stimulating hormone. And if the doctor will feel that there may be involvement of some autoimmunity, then he may also ask to go for autoantibody titer. So that will reveal whether the person is having some autoimmune problem, and because of that the thyroid cells are affected and there is a hypothyroidism. And in some of the cases where some malignancy or some cancerous changes in the gland is uh, felt by the doctor after physical examination, he may suggest to go for FNAC, that is, a small amount of cell is taken, fine needle aspiration test, fine needle aspiration cytology. A very small amount of cells are taken from the thyroid gland and they will go for the detailed study of it, whether there are any changes, cancerous changes, or whether the cells are in the normal structure. So that all will be done. And isotope scan, ultrasonography, these all are the other investigation the doctor may go for to know if there are some other abnormalities. So this way the diagnosis is done. So the medical history and physical examination and investigation, that all are required to diagnose the thyroid dysfunction or the hypothyroidism. So sometimes when TSH level is normal and T4, T3 level is high, in that case, the doctor may suggest to go for free T3 and free T4. So actually the free T3 and free T4, they are the real active part of our thyroid hormone. So if there is normal level of thyroid stimulating hormone, the doctor may suggest to go for free T3 and free T4 level. So the women, those who are above 40, it is recommended that at least once in 6 months they should check their thyroid functions. So preventing and treatment of hypothyroidism. So generally when hypothyroidism is there, the hormones are not secreted, then the doctor will go for thyroxine. That is generally the hormonal supplement which is given depending upon the underactivity or depending upon the level of your T3 and T4 and how much active your gland is. So based on that, the dose will be decided and the doctor will go for the hormonal supplement. So what are the lifestyle measures for thyroid functions? So the important thing is healthy diet, regular physical activity, at least 30 minutes most of the days in a week. We have to be physically active. We may involve in some yoga practices or we may involve in some running, walking, these kind of, or any sportive activity. So at least 30 minutes in a day we have to be very physically active. Then proper and timely sleep is very essential, and avoiding the smoking, alcohol, these all bad habits that we have to avoid for maintaining our thyroid functions. There are several research. The effect of regular physical exercise on the thyroid function. So here the article suggested that every young to middle-aged hypothyroid patient should do regular physical exercise to improve his or thyroid status. So just taking medicine is not enough. If you are thinking that I am taking this hormonal pill and that will be sufficient, so it will further deteriorate your thyroid function. So you have to be physically active and that will help to even reduce your amount of uh, medicine which you are taking. Then another article. So this article also concluded that in conclusion, healthier lifestyle improves body composition, thyroid function and structure. So the thyroid function will be improved by involving in regular physical activities. The yogic practices, the impact of yoga upon female patients suffering from hypothyroidism. I already told that the female are more affected compared to men because of this thyroid dysfunction. So involving in yogic practices that helps to maintain the thyroid function, and the yoga is very helpful in controlling your thyroid function. And even a person who is already diagnosed with hypothyroidism, in that case also the person will be highly benefited because of regular practice of yoga. So this article concluded that yoga may be considered as supportive or complementary therapy in conjunction with medical therapy for the treatment of hypothyroid disorder. So you may be taking the tablet regularly, but if you are involving in yogic practices, especially the pranayama, there are research which says that Ujjayi pranayama is very helpful, and even other physical activities like Surya Namaskara or some asana practices and some pranayama practices, balancing pranayama, that is Anuloma Viloma, Nadi Shuddhi pranayama, Brahmari pranayama, and Ujjayi pranayama. This all will be helpful for your overall health and also for your thyroid function. So yogic management for hypothyroidism, a case study. So this study, it revealed that after the end of yoga therapy, the TSH level, that is thyroid stimulating hormone, which regulate the function of thyroid gland, so that reduced to 5.82. So this is the normal level. The patient did not undergo treatment with modern medicine. So that much good result may come. The person who is already diagnosed, if he is dedicatedly involving in yogic practices, it may possible that he can maintain his thyroid function to the normal level even without modern drugs. So there is another research article which says that effect of yogic practices on thyroid function. So this article concluded that one can conclude that yogic practices brought hormone balance in the body. So if the person is sincerely practicing yoga, pranayama, meditation, so he can maintain his normal thyroid functions. So there are gaitrogenic food that should be avoided by the person who is suffering with hypothyroidism or who is in the subclinical hypothyroid state. So there are several gaitrogenic food like the sweet potato, linseed, and cauliflower, broccoli, peanut, spinach, rapeseed, soybean, millet. So these all are known gaitrogenic food. That means they affect the thyroid gland and they will not allow the thyroid to function properly. So if a person already suffering with thyroid disease, he should avoid these food, and even we have to minimize intake of these foods to maintain our normal thyroid functions. So this is in brief about how our lifestyle and our dietary habits will be helpful for normal thyroid function. GPI, if
Nice, Bhaiya. So,
any of the participant they want to know something more about this hypothyroidism or thyroid dysfunction, and if any other queries they have, they may please ask.
Sir, namaste, sir. I am Professor Ranganath, sir.
Ji, sir, namaste.
Namaste, sir. How are you, sir, today?
Sir, I am fine, sir. Thank you so
Sir,
much.
I have a small doubt, sir. I would like to
Please.
clarify. If you allow me, I put forward,
Please,
sir.
sir. Please, sir. Please, sir.
Yeah,
This session is for you, sir.
sir, especially I teach 4 to 5 hours every day, sir. I teach English and advanced communication skills. Does it affect, sir, teaching for 3 to 4 hours daily, sir? It affects thyroid gland, sir.
Please repeat, sir.
Sir, I teach 3 to 4 hours, sir, every day.
Speak. Okay. No, sir.
I teach, sir.
No, sir. Teaching will not affect your thyroid function.
Yes, sir.
You can, yes, sir. You can continue, sir. No problem.
That's
Teaching will not affect your.
yes, sir.
Yes,
Yeah. I saw some of my friends' father taking thyroxine, sir. I asked him
Yes, sir. Yes, sir.
why, because TSH is a little bit high. That doctor advised him. Good,
Yes,
sir.
sir.
Your lecture is very enlightening us. Sir. It keeps us very healthy, sir. That is what we want. Healthy society, healthy people. Thank you, sir. So I'm a little bit worried about teaching hours together, and some of his work may affect our thyroid gland. My doubt is clarified. I remain grateful, sir. Thank you. Bye, sir.
Sir, as you very rightly said that the TSH level is high.
Yes,
so
sir.
TSH is produced by the pituitary gland.
Yes.
And TSH means thyroid stimulating hormone.
Yes.
So when thyroid gland is underactive, the TSH level will be high. That means the pituitary will secrete more TSH to activate this thyroid gland.
Yeah.
So when there is a TSH level is high, it is indicative of hypothyroidism.
Oh, sir. Yes.
So because to maintain the thyroid hormone level, the doctor will go for thyroxine, that is hormonal supplement, to maintain all the bodily function, maintaining the energy production, protein synthesis, carbohydrate metabolism. So that all are regulated by the thyroid hormones.
Thank you. Good. Nice.
To maintain all those things, the medical management is going for hormonal pills.
Okay, sir. Do you mean that sweet potato is like ordinary potato, sir?
No, sir. Sweet potato is not this ordinary potato. Sweet potato is sweet, and it, like many of the people, they consume it when they are doing fasting.
Yes, sir. Yes.
In our Andhra Pradesh also it is consumed.
People they eat in the evening, just treating them as snacks also, sir. Sweet potato. Thank you, very enlightening, sir. And we keep our health.
Actually, those, sir, thank you, sir. Actually, those who are already suffering with hypothyroidism, they have to avoid intake of cauliflower, spinach, broccoli, soya bean. So these food which are very commonly consumed, so that they have to avoid, because these food, they affect the thyroid function and they will further deteriorate the condition.
Yes, sir. Well, some people say broccoli, usually we see in the pizza and burgers, broccoli taking in other countries like USA. Good, sir.
Actually, the situation in India is like most of the vegetables which are there in our market.
Yes, sir.
Many of these vegetables are not Indian, or the things which we are consuming traditionally.
Yes, sir.
So like you take even the cauliflower, tomato, chilies, these are not Indian. Even the potato is not Indian. It came from the other countries, and actually the Britishers, they brought this potato here. And actually the tomato, it was first grown in Uttar Pradesh, somewhere near Sultanpur area. Chilies. So many of these things are not Indian, and they have a long-term effect on our health. So Actually, the people who are already having some thyroid dysfunction, it is better that they should avoid the
Good.
gastrogenic food. They
Yeah.
may get these details easily in the internet also, or like some of the things which I told, that the
Yes.
millet, soybean, and cauliflower, broccoli,
Yeah.
spinach, these
Yes.
all they have to strictly avoid.
Good. Good. Sir. So
Sir,
I pass it on to my colleagues and students, sir, in the
sir,
class.
sir,
I teach a
sir, my
holistic health.
pleasure.
Thank
Sir,
you
sir,
very much, sir. Thank you
sir,
very much.
sir.
Sir. Bye. Bye. Bye.
Welcome, sir, welcome. Yes, sir.
नमस्ते भैया.
जी
Hello.
दीदी नमस्ते. Namaste.
Bhaiya, is there any Ayurvedic medicine instead of allopathic medicine? Because my mother is suffering from this.
Yeah.
She's taking 150 mg of thyroxine tablet.
Yeah.
Instead of that Ayurvedic medicine, or can we go for any different kind of diet she can regularly follow? Is it possible way?
Yeah, there are researches that some of the Ayurveda medicines, they are helpful in case of hypothyroidism. But initially, we do not recommend to suddenly drop your hormonal pills and directly take this Ayurveda medicine. You can continue both, and you can check your thyroid function regularly. And if the condition is improving, gradually you can withdraw your the pills. Like you told that 125 mcg they are taking. So gradually it can
150
be
mg
reduced.
she is taking.
So
Okay.
gradually it can be reduced. So there are researches on some of the Ayurveda medicines. So like one medicine is Chitrakadi Vati. So this is consumed 250 mg dose twice after food. So morning and evening. So that helps to maintain the thyroid functions. And there is one more research article on use of Triphala Guggulu and Punarnavadi Kwath. Punarnavadi Kadha is available. Triphala Guggulu is also available. And Guggulu is known drug for thyroid stimulation. So it improves thyroid function. So that is well known. It is scientifically proved. So that is one option. And there is again a few researches which proved that the Varunadi Kwatha, that one, this particular decoction, Varunadi Kwatha, so that is also helpful in thyroid function. But actually what I suggest is, if you have any good Ayurveda physician nearby your place, so you can consult once, so he can see what are the levels of these things are there, and there you can regularly visit, and you can gradually reduce your hormonal pills dose. And along with that, I will also suggest that you go for yogic practices, especially this Ujjayi pranayama. There are Yeah, please. Hello.
She aged, Bhaiya, she is around 60 years now. If she can follow, she will work very
Yes.
hard.
Yeah. Actually, the pranayama practices are very easy practices. With some minimum guidance, definitely she can practice these. So, any some yoga experts, or there are videos in our previous sessions where Dr. Sundar Raj, he took about the details of this pranayama practices, yoga practices. So you can go through those videos and you can follow, and you can suggest that involve in some physical activity and this pranayama practices. Actually, along with some herbal medicine pranayama practices, that will help to gradually reduce the dose of your hormonal pills, and it should be done under the medical supervision, because I already told that the thyroid hormones are required for each and every cell of our body for their normal functioning. So it should be done with proper medical supervision. Then only you can gradually plan to withdraw or plan to reduce your present hormonal pills.
Okay. Thank you, Bhaiya.
जी
Thank you for the information.
जी 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 जी
जी मनोरमा जी नमस्ते, हीरा जी नमस्ते, मुझे राज को कमेंट जी मनोरमा जी नमस्ते।
अभी अटेंडीज जो भी हैं उनको अगर भैया से कोई क्वेश्चन पूछना है, एनी ऑफ द अटेंडीज इफ दे वांट टू आस्क एनी क्वेश्चन, इफ दे हैव एनी क्वेरी, दे आर मोस्ट वेलकम. You are having mic, you can unmute it and put your question, please.
नमस्ते भैया, दीदी कहना है.
जी रूपा.
हाँ, yeah, भैया, you said because of the excess of iodine, this problem occurs, right?
Yeah.
We require only. So nowadays, children are more into junk food. So many packets are there in the shop, and they try to buy it. So there is a lot of salt in all this junk food, what we eat. And I remember that salt contains iodine. So is it that excess consumption of iodine will be through this junk food, and they might suffer with this problem in future, or it has nothing to do with it? That is what is my question.
Yeah. Actually, the research says that most of the people, they can tolerate the higher amount of iodine, and there are less amount of people who cannot tolerate it. But what happens is, if we just see even the less amount, if I say that out of 190 can tolerate and 10 will not, but even if we take this 10, the amount of people who are suffering with this is very, very huge considering the Indian population. You can understand the burden of this disease.
Yeah.
One important thing is the iodine is very, very, very essential for normal thyroid function. But when there is a persistent high amount of iodine in our circulation, so that high amount of circulation of this iodine will affect our thyroid gland functions. And it may create anything. It may create a hypothyroidism, it may create hypothyroidism, or it may create some kind of autoimmunity related issues. So maximum of number of the people, they will suffer with the hypothyroidism. The thyroid will become underactive. It will not produce sufficient amount of T3 and T4 hormone. Then, yeah. One important thing is this: how much amount of salt we require in a day. So it is just nearly 6 grams. But most of the people, they consume 2 to 3 times the amount of iodine which is added to this salt is considering what is the normal amount of salt the person is required in a day. But most of us, we consume much more than what is required for our body. So nearly 6 grams salt is sufficient for a person in a day. But many of the people, they consume 2 to 3 times higher than what is recommended. So when we are taking excess of salt, it also means that we are taking excess of iodine. So when iodine is high and when there is a persistently high amount of iodine in our blood, so that will, in a long run, it will affect our thyroid function. This is what is happening. And if you just see some two decades ago, there were not much patients of this thyroid problem. But nowadays, the people who are suffering with thyroid function is very, very high. So there are researches which proves that there are role of this excess intake of iodine. And there are other things also, because gradually we are becoming more and more physically inactive. Our lifestyle is changing, the food habit is changing. many of the people, they are consuming food which are affecting our diet, our thyroid function. We are consuming food which is poured with pesticides, fertilizers, all those
Yeah.
things. So these uh, fertilizers and excess amount of this pesticides, they are all thyrotoxic. Thyrotoxic means they damage our thyroid gland.
Mhm.
So actually that is how we see a huge number of people, they are suffering with this problem.
Mm.
So one important thing is we have to minimize, or we have to, if possible, we have to completely avoid intake of junk food.
Yeah. Yes.
And yeah,
I think this
another
excess
thing is
salt leads to the blood pressure issue also, no?
definitely, yeah. So the blood, they're not only just one problem, it's like it will
Yeah.
bring a group of problem
Yes.
if you are taking in a irregular way or the high
Yeah.
amount.
My sister,
So
she had a habit that whatever is cooked in the house, she used to take the salt and used to add while eating, you know. And slowly we observed, like when she was young, she used to get this kind of sujan, bolte hain na, like in her body and eyes and all. So swelling, that kind of. So I always used to relate it to her salt intake. And was that true, Bhaiya, that this swelling will be there if you eat excess of salt?
yeah, so many problem, because excessive amount of this sodium is there with, when we are taking this, it will create a lot of problems, not just one thyroid or iodine related issues, but the
Mhm.
hypertension and many other issues will be because of excess
Mhm.
intake of our salt. So, and one again,
Yeah,
like
may I ask
traditionally,
something? Namaste.
yeah, namaste.
जी विनोद भैया उनकी बात पूरी हो जाए अखिलेश भैया
जी
की पहले
जी जी
So actually, traditionally in our cooking, we are using this rock salt, what we say the sendha namak.
Hmm.
So sendha namak is having many other minerals which are
Hmm.
not present in our sea salt.
Okay.
So that so that is the another thing which we have to shift gradually, and we have to start using this rock salt in our
Okay.
daily cooking.
Mhm. Yeah. Nowadays we get that rock salt at many places. And I used it and I saw that taste is same. Like there is no difference. I mean,
Yeah,
whatever
easy.
amount of salt, normal salt you add, the same amount of rock salt you add, it gives the same taste. So there's no difference.
So actually, compared to your sea salt, rock
Huh?
salt is more beneficial.
Okay. Mhm.
जी जी
Okay, भैया. Thank you. Thank you.
your queries first जी
Yeah.
विनोद भैया how you can put your query please विनोद भैया जी अब आप अपनी बात रख लीजिए प्लीज विनोद भैया अब आप अपनी बात रख सकते हैं प्लीज Am I audible?
Yes, Didi, you are audible.
Vinod Bhaiya, you can please ask, or you can please share.
Vinod Bhaiya, you wanted to say something?
Yeah, am I audible now?
जी भैया.
हाँ दीदी नमस्ते, भैया नमस्ते.
Namaste भैया.
So, as far as the thyroid is concerned, for which iodine is required in the system, and we know that only traces are there in the traces of iodine are there in the system. So, what is our opinion about this iodized salt, which is made available, these marketed these days available, and as against that, rock salt is there, Seza namak is also there. What are do's and don'ts? So it will be better because our younger generation, they are going in for fast foods as against natural, regular, nutritious food. Of course, we are trying to understand ourselves and make them understand also. But still, what and how?
So one thing भैया, Actually, the salt and iodine is required for our normal thyroid function.
Yeah.
But the amount of salt which is required for our normal functioning in a day is almost about 6 gram is sufficient.
Right. We are
And-
consuming more, and there are some people in the house where without tasting also they put salts.
So that all we have to reduce this kind of habit. And if you gradually reduce, you will enjoy even like now what you feel is having less amount of salt. After once you will practice it for few days, you will realize that even the less amount of salt is sufficient for you.
In
So
our kitchen, we have started using this Senda Namak. Or
this is very good, Bhaiya. Very good. So rock salt is very good for our health.
And as far as
And
curd
traditionally,
is
we are using
concerned,
the
we are
rock
not
salt
using
only.
anything in the curd, neither sweet nor salt.
Ji, Bhaiya.
We are
But
because
even rock salt also, you consume only the required amount. It is not that rock salt, so we consume it more or we put in everything. We are sprinkling this salt and consuming it. So that is
it
not
has
good habit.
it has got a bearing on blood pressure level also.
Definitely, yeah. We need salt, we need iodine, but we need only in required quantity. I already told that in a day, the amount of iodine which is required is 125 millimicrogram. So that
Please
much
repeat it again. 25?
125 mcg millimicrogram we required. So
okay.
So actually,
so what should be the frequency of getting it monitored?
so that same thing I told, that if you are consuming nearly 5 to 6 gram of salt, that will
You were telling.
sufficient for your iodine intake.
Yeah, what I was asking is whether we are heading towards excess or abnormalcy. So body is required to be monitored after how many months or frequency of that test.
Actually, 6 months once, if you are going for your thyroid function, that is sufficient, yeah. And actually, if it is regular, then once in a year is also enough.
The situation
person
is
who
now very
who
alarming. Earlier, we never used to hear about thyroid. Now, number is more.
Yeah. So actually,
Please
after
develop,
40,
please.
after fourth decade, we generally say that you go for once in a 6 month, go for the thyroid function test. And thyroid function test, it includes your TSH, T3 and T4 level.
T3, T4, TSH.
Ji.
Okay. Thank you very much. It has been very educative. Very nice to learn.
It's my pleasure. Yeah.
Thank you, sir. We are great.
Thank you, Bhaiya.
My pleasure. Yeah.
If there is a query, you may please raise the hand, or you are having the mic, you can unmute and put your query, or you're sharing.
और इस टाइम और सुनिधि we can
Yes. And I think all the queries have been satisfied now. It's already, time is already over. It's 8:32 now. So, should we close for today? We'll be meeting next week. Thank you so much, Akhilesh Bhaiya. And thank you so much all the panelists. And it has been very informative session. Yes, one thing I would like to add over here, that we get information so much, but what is going to affect us is if we practice it. We talk about exercises, but even if I see myself, I'm not able to exercise that much. I would request to be physically active so that all of us are able to maintain our health. Thank you so much for the day. Thank you, Bhaiya.
Namaste.
जी नमस्ते everybody. Namaste.
थैंक यू भैया, नमस्ते।
Thank you भैया, नमस्ते, नमस्ते everyone.
Namaste.
अभी टाइम हो गया ना दीदी, नहीं तो मैं पूछती थी प्रश्न, नेक्स्ट टाइम पूछेंगे।
जी जी जरूर
हाँ
जरूर
जी सर, सॉरी आई कुड नॉट इंटरफियर, यू नो, आई डिडंट लाइक इट,
जी
आई वाज हियरिंग, पेशेंट हियरिंग।
जी जी
नेक्स्ट टाइम वी विल डिस्कस। थैंक यू सर,
जी
गुड नाइट,
So much.
नमस्ते।
नमस्ते सबको नमस्ते।